Hello everyone, we'll be learning about muscles of arm today. I know you don't have time to lift weights, but you can definitely lift your marks if you watch this video completely. So coming to the first muscle, that is biceps. As in the name it says, it's biceps. So it has two heads, and you can see it's going in inserting into your radius bone. That's your radial tuberosity. Let's look at this in detail. So coming to the heads, two heads of the biceps. So as you can see, this is the short head. So this is arising from your tip of the coracoid process. Tip of the coracoid process. That's your short head. Now this thing is called your long head. So it's arising from your supraglenoid tubercle. Supraglenoid tubercle. So why is it called supraglenoid? You see this cavity where the head of the humerus is going and attaching. So that's called glenoid cavity. Above it is called supraglenoid. Below it is called infraglenoid. So simple. So this is your origin of your biceps muscle. Coming to the insertion, as you can see, it's going and attaching into your radius bone, and this part is nothing but your radial tuberosity. So it's going and attaching into your radial tuberosity. Posterior part, to be more precise, and you can see something. There's a white sheet structure. This is nothing but your bicipital aponeurosis. It's a very important thing. It protects your underlying structures, that is your brachial artery and median nerve. It's very important. So this is your biceps muscle. Now let's look at how to draw this in exam. So as you have seen the 3D of the biceps muscle, let's just quickly look how to draw in the exam. First, simple, you just draw the scapula. Okay, and then your head of the humerus and your complete humerus bone, and below it you draw the radius bone. Simple, done. Now one from your supraglenoid tubercle, one from your tip of coracoid, as you have seen in the 3D. So now connect these two. Now just extend it till your radial tuberosity. Done with your biceps muscle origin. From the short head you have your from the tip of the coracoid process you have your short head. From the supraglenoid tubercle you have your long head. So this is from your tip of the coracoid process. This is from your supraglenoid tubercle. Supraglenoid tubercle. So done with your origin. Origin of biceps muscle is done. Now you are seeing the insertion. This is going and attaching this part, right? This part is called your radial tuberosity. Radial tuberosity. Don't mind the handwriting. Just go and check in the textbook. You'll find it better over there. So this is your insertion. The muscle is inserting here. So there's one extension while inserting. There's something called as bicipital aponeurosis. You see this green part? This thing is called bicipital aponeurosis. Now what this does? What is the function of this? This protects your underlying brachial artery and median nerve. So example, let's take, this is your median nerve. Sorry, median cubital vein. This is your vein. This is where the venipuncture is taken from your this vein. The blood is drawn from this vein. Below it, here we have your bicipital aponeurosis, and below that you have your brachial artery, and then your median nerve. This is your median nerve. This is your brachial artery. Brachial artery. This is your vein, median cubital vein. So that's how it's protecting your underlying structures during venipuncture. Now coming to the nerve supply, the nerve supply of this muscle is musculocutaneous nerve. Musculocutaneous nerve. Don't mind the spellings also, just go and check it in the textbook. Musculocutaneous nerve. Now coming to the actions of this muscle. What are the actions? First one, it's a strong supinator. The strong supinator. Second one, it's a powerful flexor. You flex, you flex your biceps, even though there's nothing. So it's a powerful flexor. So that's all. Now coming to your coracobrachialis muscle. You see this short muscle, this is your coracobrachialis muscle. So now let's look at this in detail. So as you can see, the origin is from your same tip of the coracoid process along with your short head of your biceps. Remember, tip of the coracoid process. So this is along with your short head of your biceps too. Don't mind the handwriting. I'll just show it to you neatly in the next. In the drawing. So coming to the insertion, as you can see, this is the middle part. So of the humerus bone. This is humerus bone. So middle part, and as you can see, this is lateral side. This is medial side. So this is on the medial side. So middle part and medial border of the humerus bone. So middle part of the medial border of the humerus bone. So that is the insertion. So this is the origin. So now let's see how to draw this easily in the exam. First, how to draw this? Same again. A scapula first. Then again the humerus bone. Same as I've seen in the biceps. It's from the tip of the coracoid process. From the tip of coracoid process. It's coming along with your short head of your biceps. It's along with your short head of your biceps. Remember? It's going and attaching into your humerus bone. Where in the humerus bone? Middle of the medial border of the humerus. This is medial side. This is medial. This is lateral. So middle of the medial border of the humerus. So this is how your muscle is coming. This is your coracobrachialis muscle. The nerve supply, it is also by your musculocutaneous nerve. Cutaneous nerve. Coming to the actions, it's a weak flexor. Actions. Actions are weak flexor. Weak flexor and the adductor of the arm. Adductor of the arm. At the level of insertion of coracobrachialis, there are 8 events. We'll look at that in the next video. What are the 8 events occurring at the insertion of your coracobrachialis? There's 8 events over here. Let's just look that in the next video. Now let's proceed to the brachialis muscle. So now let's look at your brachialis muscle that is present beneath your biceps. So as you can see, this is your brachialis muscle. So let's look at this in detail. So coming to the origin first. So as you can see, the origin is from lower half of your anterior aspect of your humerus bone. So lower half and anterior aspect of your humerus bone. So that's your origin. Coming to the insertion, where is it inserting? As you can see, this is your ulnar bone. Okay, so this is your coronoid process. This is your coronoid process, so it's attaching into the anterior surface of the coronoid process. Anterior surface of the coronoid process. So this is the origin and insertion of the brachialis muscle. Now let's see how to draw this easily in the exam. Let's look into your brachialis muscle. So first, draw the humerus bone here. Then draw your ulnar bone. Let's say this is your ulnar bone. This is your humerus. Now where is it arising from the humerus? You see this lower half. It's coming from the lower half and the anterior surface. So it's arising from your lower half of anterior surface of your humerus bone. It's going and attaching where? It's going and attaching into your ulnar bone. Where in the ulnar bone? In the coronoid process. Coronoid process. So this is your anterior surface. So anterior surface of your coronoid process. This is your insertion. This is your origin. Now coming to nerve supply, the most important part of this muscle, it has dual innervation. That means it has 2 nerves supplying this. Dual innervation. The first one, medial 2/3. medial two-third. You see this medial part? This is medial. This is lateral. Medial two-third supplied by your musculocutaneous nerve. Musculocutaneous nerve. And second one, lateral one-third. Lateral part. So lateral one-third by your radial nerve. Lateral one-third by your radial nerve. Now coming to actions. It's a powerful flexor of your elbow joint. Strong flexor of your elbow joint. That's why it's called workhorse of elbow joint. Workhorse of elbow joint. So this is about your brachialis muscle. You have seen your origin, insertion, actions, nerve supply. That's all. Coming to your triceps muscle. This is your triceps muscle. As the name indicates, it's a three-headed muscle. These are the two heads, and the third head is arising from your posterior aspect of the humerus. And then you can see it's going and attaching into your olecranon process. We'll see this in detail. Now coming to your heads of your tricep. This is your long head of your tricep. It's arising from your infraglenoid tubercle. As I've already explained you what is glenoid cavity. This is your glenoid cavity. Above that is called supraglenoid. Below that is called infraglenoid. That's from supraglenoid you have your long head of your biceps also. So this is infraglenoid, your triceps head, long head. And next, this is your oblique ridge, from where your lateral head is arising from. Lateral head of triceps. And then you can see on the posterior aspect of the humerus bone, this is your medial head of your triceps. So this is the first head, second head, third head, three heads of your triceps. Now coming to the insertion, as you can see, this is your olecranon process. Olecranon process. This is your ulnar bone. So olecranon process of the ulnar bone, to be more precise, posterior part and superior part of the olecranon process. Superior part and posterior side of your olecranon process. This is your insertion of your triceps muscle. So let's look at how to draw this easily in the exam. So coming to triceps, it's the most easiest muscle to draw in the exam. You don't have to draw the muscle. So first, draw your scapula. Let's say this is your scapula and your humerus. So here you just have to three heads. One from the infraglenoid tubercle. This is your infraglenoid tubercle. As you have seen, biceps from the supraglenoid, triceps from the infraglenoid tubercle of scapula. So done. One from the oblique ridge. There's an oblique ridge here. This is above your spinal groove. One from your oblique ridge of your. This is posterior aspect of your humerus. This is your posterior backside of your humerus bone. Oblique ridge, and from here you have your lateral head of triceps, and then you have, there's a spiral groove here where your radial nerve and your profunda brachii artery passes through this. Below this there's one more medial head, where from the medial head arises from posterior surface of your humerus. This is your, from where medial head arises from. So coming to the insertion, it's gonna take place in the posterior part of the superior surface of olecranon process. So let's say this is your olecranon process. Posterior part, superior surface of your olecranon process. Where is this? It's in your ulnar bone posterior aspect. Olecranon process. So that's all. You have your first head from your infraglenoid tubercle, second head from your oblique ridge above the spiral groove. This is your spiral groove where your radial nerve passes. Spiral groove. And your third head, below the spiral groove, your medial head arises. So three heads, that's why it's called triceps, three heads. Insertion into your olecranon process of the ulnar bone, superior part of your olecranon process. That's all with your triceps. The nerve supply of this is radial nerve. The nerve supply is by your radial nerve. As you can see, radial nerve passing here. This is your radial nerve. This is your radial nerve. So it is supplied by your radial nerve itself. Okay, coming to the actions. Actions of this muscle is, it's a strong extensor. Simple. You have to extend, right? To extend, so strong extensor. So that's it with your this thing. Triceps. Origin done. This is your insertion. Nerve supply, action. That's all.